Good afternoon, everyone, and welcome to the first meeting of the Lower Makefield Township Disability Advisory Board in 2021. So we have an agenda full of things to get through this afternoon. First thing I want to do is I want to say welcome to Lynn, who is a new member of the Disability Advisory Board. Lynn,
Thank you.
I'm not gonna, I won't put you on the spot too much, but we're really interested in what you bring to the table, and love to see you participating in this board. So we're really excited that you joined us.
Thank you.
So, okay. So the next thing we're gonna do is we're gonna have an approval of last meeting's minutes. And then we'll jump into the selection of officers for this year. So is there a motion to approve the minutes from last meeting?
I make a motion to approve the November 19th, 2020 meeting minutes.
Okay, is there a second to that? Is there any discussion?
Trish?
Is there any discussion?
No.
Okay, all in favor, say aye.
Aye. Aye.
Aye.
Okay, all opposed say nay. Okay, I think the ayes have it. Okay, so the next thing that we will do is we will talk about the selection of 2021 officers. So is there, we need 3 officers, I believe. We need a chair, a vice chair, and a secretary who is in charge of meeting minutes. So are there any, is anyone interested in jumping into any of these roles?
So Dave, I'm assuming you do not want to be chair?
Well, I mean, I am willing to serve in this type of capacity as chair or vice chair this year. My term will be over on December 21st. I probably would have a preference for vice chair, but if absolutely no one wants to pick up chair, I can do it. It'd be nice to probably have some continuity as chair, someone who's going to be here next year.
Well, Lisa, why, I would nominate you. Let's go back to you.
Thanks,
How do
Dave
you
and
feel about
Trish.
that? What's that? Well, you have the
Thank
experience,
you,
you and
Trish.
Dave and David.
Yeah.
Lisa is a much better chair than I ever was, so I would be in favor of that. Lisa, if you're interested in it.
I will accept.
Okay.
And then we'll just do all of them. So for me, chair, who wants to be VP? I nominate Dave Mann then for VP.
Second that, yeah.
Okay.
We'll make the motion, I guess, after everybody. And who wants to be secretary?
Ugh.
Trish?
Well, I'll do it. I just am not very good at that role. But if nobody else,
Are we gonna?
if nobody else
We'll
wants
do the
to
same.
do it,
The same arrangement. If you take the notes and then forward them to me, and I'll format them.
clean them up, sure. Sure.
Lynn, if you're really good at typing, you could be a secretary if you'd
It
like.
could be secretary.
Guess you read my resume. I was a business ed teacher, huh?
Well, if you're interested in that, maybe I know this is your first meeting, so, but if you want to come alongside Trish sometime in the year and help with minutes,
Trish, I'll be glad to help you.
Okay, great, thanks.
good arrangement. So it sounds like we have a slate of Lisa as chair, myself as vice chair, and Trish as secretary. Does someone want to nominate that slate?
I'll make the motion.
Okay, is there a second?
A second.
Okay, all in favor, say aye.
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 Okay, all opposed, say, well, everyone said aye, so I'm not even going to ask for the nays. Okay, so we have our officers. So next, we're going to go through kind of a list of things that we've been doing in this virtual setting. First, we're just going to go through community reminders, just the existence of Smart 911 so that township residents would know about it. Also, talking about Lower Makefield Police and a list or a form that you can fill out to let them know of your special needs. And then finally, I also want to talk about new develops on the pandemic's effect on people with disabilities, which given that we are in the height of the pandemic, those effects are quite extensive right now. So I'll mention Smart 911. Smart 911 is it's available on the website. It's also available on an app. It's a county level tool, and what it allows you to do is allows you to complete a very detailed profile of yourself, and it is something that is available for first responders. If you call 911, they would have access to all of this information that you've provided to them. So health conditions, needs, any kind of thing that you would want them to know in an emergency, you can provide to them through Smart 911. The app also, when it's open, also lets you know well, actually you can change it in your settings, but the app is capable of letting first responders know where you are, your location on your phone. So if that is something that is helpful in a certain situation, you can use that, though you also might have feelings about privacy. So you might not have that setting on as detect all the time if you don't want that intrusion into your life. So Smart 911 in a summary is a great option if you want first responders to know things about you before they arrive at your car or your house or wherever they're being called out to assist you. The second thing, and I always turn to Lisa for this because she understands a little bit better than I do, is the Lower Makefield Township. I don't want to call it a list or a form, but they have a way of being able to capture people who have special needs as well. Lisa, can you speak about that for a moment?
Yeah, just it's a form you can fill out on the lmt.org website if you go under forms, and it's a special needs premise form, and can be given to the Lower Makefield Township Police Department and will be input into the 911 system to alert first responders of any situation at your residence that maybe would be helpful for whether it's a fire or police department that may come to your house and would be helpful for them to know, prior to entering, or someone needing assistance. So you can just send that to the Lower Makefield Township Police Department.
Okay, thank you, Lisa. So the next thing I want to talk about are, again, new developments on the pandemic's effect for people with disabilities. And we could be talking about the township. We can talk about effects within the Commonwealth or our region or even the country. I have some things to say, but I'll chime in a few minutes. I want to see if any of you have anything that you would want to share, anything that you found noteworthy in the past weeks. It's been about a couple of months since we've met, so there's a lot that has happened pandemic-wise.
No, just excited that hopefully, people will be getting their vaccine as soon as possible. I know educators are in the next group. I know my daughter is getting it tomorrow. She's in Virginia as a educator, and hopefully that will be able to get children, especially children with special needs that learn best in person. I think that will be a road to getting people back in person more quickly.
I think it's significant to note that Pennsylvania is running way behind other states in getting the vaccine out to the people. I know Jersey is way ahead of us, and supposedly they were going to make some sort of an announcement, I thought, today, but I haven't seen anything yet.
Right. I haven't seen anything. I think we're in a very interesting time because, I mean, the vaccine is great. I mean, the hope of the vaccine to end this pandemic is a great and amazing. I think it's also important to realize at the same time that we still need to be vigilant. That, you know, unfortunately, thousands of Americans are dying each day, and I think that people. I know it's difficult, but we're in the home stretch to make sure that they're social distancing, taking proper precautions, staying home if they can. One other thing, I think all those things are important if you're a person with a disability. This is you don't want to contract this and die in the final months of the pandemic, right? When we already have a vaccine. The other thing that kind of concerns me, I've been seeing news articles about, is the difficulty that some people with chronic conditions are having getting the vaccine in a timely way. There are people out there with chronic conditions who may need nursing home level of care, but they may not be in a nursing home. They may still be in the community, and this group has really had a hard time trying to get vaccinated, yet they are among the most vulnerable to the pandemic. And that's, I found that kind of disturbing. People look at me with my condition and say, oh, well, you must be one of the first to get a vaccine. And I say, well, no, not really. If you look at the ordering in that Pennsylvania has left out, you know, I think I fall into 1C because I am not a medical professional. I am not a first responder. I'm not over age 65. So I think this is a concern, unfortunately, and it does vary state by state, but my hope is that people with really serious conditions who need that level of care are able to get their shots or vaccines sooner rather than later.
I did hear, I'm not sure if anyone's tried to get on a list or find out where vaccines will be available, but I know that Acme in Newtown is compiling a list. If you can you can go and register there, get on a list. I don't know if that will help anybody, but that's the only place I know of that's taking names.
My daughter went to the Wood School today. She's an SLP in the schools, and I guess she's considered medical, essential medical, and that's where she got her vaccination. I'm not sure if that's open to the public yet or not.
Yeah. Yeah, no, it is. It is. And yeah, it's, you know, I'm torn with that because Lynn, I'm thrilled that your daughter is vaccinated, right? But your daughter, my assumption is that she's probably younger and healthy, you know.
She's definitely not healthy. She had a hemispherectomy. She had her right brain removed. But
well,
she's an SLP in the schools, and they consider her medical. Plus, she has her other health issues. So I was very happy that she was one of the first to get.
I think she should have been at the front of the line because of her health condition.
No, she wasn't.
Yeah, it was because of her. Yeah, it was because of her employment status.
Right.
Right. Well, either way, I am glad that she was vaccinated. But I think the story helps prove the point that I was talking about, that there are people out there who have serious health conditions who are not near the front of the line, not even at the middle of the line.
I am on the website for it's health.pa.gov, and they do have a list of COVID-19 vaccine provider locations week 1 through 5. So that, if anyone needs information, I would go out there, but it's Greensburg, it's Hanover, it's Manchester, it's York. There's nothing in our area that's, let's see, close by. If I look, Doylestown, there is St. Mary's, Aria, Burns Pharmacy, Central Bucks Family Practice, and Doylestown Hospital. So they are listed. Rothman Orthopedic. So these are distribution sites listed, but I'm sure there's more information that people can find on that website.
Right.
And again, it's health.pa.gov, and then just follow, topics, disease, coronavirus.
Okay. Well, thank you. That is.
Thank you.
Yes.
Mhm.
And I was also just looking at the Bucks County reported COVID cases in the last 30 days. We have within Lower Makefield Township 565 reported cases in the past 30 days. Okay, so moving on with our agenda. So we're going to the updates part of our agenda, where Dave, we go to you and we say, have you seen any building plans recently? Do you have any updates on the Wegmans Cricket Track development? Is there anything new for us to review there?
I have had no contact whatsoever.
Okay. So the answer to those
Not a
questions.
good thing, but
The Prickett Track, if anyone is aware, there it is now. They had some meetings. I don't know if it was zoning or which committee it was, but I believe there's a lawsuit. So if there's some hearings going on, maybe it's the zoning hearing board. So I
It was
know
the
that they
zoning
just
hearing
did have a
board, yeah.
meeting on that. Yeah.
Well, that means
I think it was Monday night.
we're probably going to see that later rather than sooner then.
Yes.
Okay. Well, that's helpful to know. And Dave, if you get anything,
If I get anything, what I will do is let you know in between meetings that there is
Yeah.
something available that
okay,
we're
great.
looking at.
Yeah, and then we'll put it on the agenda. So the next thing it would be nice to to recap is we did have a joint meeting with the Lower Makefield Township Parks and Rec Board to discuss the Lower Makefield Township pool and their redevelopment and renovation plans. And I know 3 of us attended, Dave, Lisa, and myself. And see what both of you thought about the plans. You can speak overall about the plans, or you can speak about the disability related aspects of them.
The only comment that I would make is that I came away from that not knowing a whole lot more about what they actually plan to vis-a-vis, here are a whole bunch of options. At least that was my take from it.
Right. Yeah, no,
I feel like,
go ahead, Lisa.
well, I feel like they started the process before pre-COVID, and they felt like they just had to kind of see it through. And it was a little disjointed as far as, nobody even used the pool this past summer. So to do this pool fees, pool enhancements, it's like, let's get the pool open. They've gone so far. So I don't know that anybody's heart was in it, because, it just hasn't even been open.
Yeah.
But it sounded to me like it was not unanimous with the presentation options. So I
Yeah.
think they're probably going to go back and redo some things.
Yeah, I didn't think that it was going to be set in stone, right? Because I mean, if they're asking for our input, hopefully they already haven't made the decisions. So I think they have some options. They have some leading options. They have some things to think about, and I think that us having input at some point into the process is fine. I think that when they started the township, when they started the pool revision plan, I think that the township's financial situation was much better than it is now. So it may be a while until the pool is actually renovated, but I think hopeful that the input that we gave them regarding accessible wheelchairs and ramps are things that are incorporated into whatever plan eventually is put into action. So
I think we just need to stay on them about it sounds like they're going to redo the bathrooms prior to, the whole changing pools. So Dave, do you remember, did they say they were going to start those this coming year?
My recollection was that that's what they said.
Yeah.
But again, it was very indefinite as to what was going to happen when, from my perspective.
So my recommendation would be just to
stay on top
I
of it
think we just
and find out what they do.
Yeah. I think you just need to be on top of any plans regarding the restrooms for the upcoming year. Should be reviewed by us for sure. And I think that's probably the first, the first construction that they're going to do that we should be involved in.
I agree.
So with that, we do have to approve our portion of the meeting minutes for the Park and Rec. So do I have a motion to approve the meeting minutes for the November 19th, 2020 joint meeting with Parks and Rec?
So moved.
It has to be, does it have to be Dave or I, or how
Yeah,
does that
that's
work?
one of us, yeah.
Yeah,
I'll make the motion to approve.
Yeah, as chair for this meeting, I'm trying not to make motions or second them. So Lisa, why don't
Okay, so
I would say that Lisa, you should make the motion that you just thought you wanted, just proposed.
okay,
And Dave, you should second it.
yeah,
So be it.
Okay.
okay.
So any discussion? Okay, hearing none. Let's have a vote. All in favor, say aye.
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 All opposed, say nay. Okay. The ayes have it. So we have those minutes approved. So I want to give you an update on kind of moving to some other business. I also did share our spreadsheet with Parks and Rec. They were interested in the feedback that we had gathered to date on the various rec sites within the township. So I have not met with them. We might want to reach out to them to get feedback from them, but it's either very late last year or very early this year. I sent them the workbook. I think it was sometime in December.
I thought you were meeting with them after our meeting on that Monday.
I was planning.
Didn't you?
That, but I eventually had a work conflict, so I had to reschedule that.
Okay.
So
That's what I thought you had attended that. Yeah.
I have not met with them, but I wanted to give them the workbook because I didn't want to, keep kind of delaying they seemed really interested in digesting what we had found to date. So I'm going just to give you a background. The Park and Recs is creating like they're going after an accreditation, and the accreditation requires them to have plans to make their facilities within the township accessible. Kind of like have a plan to do it, not like do everything at once, but and so what they did is they asked for us to go to the various sites and to basically evaluate them, kind of summarize what we saw and things that would need to be changed to make them accessible. So we've been throughout the summer and into the fall, we've been going to various sites. Trish can tell you about her 5 Mile Woods experience.
No.
I think I attended that meeting where you were all discussing the different spots that you had went to evaluate. And I do remember that story, Trish.
Okay. Well, there you go.
It was only
It will live in infamy.
So that's I think that I don't know if we've done a fair number of the sites. There may be a few more to do, but we'd have to. There's not many, and I think that now we're kind of started starting to transition to the point where we need that to be in a dialogue with Park and Rec about what we saw and how they can meet the address the issues that we found.
I think we've got to get them to at least include us as they decide that they're going to do one thing or another, to include us in it right from the very beginning, so that, whatever changes they're making incorporate our thinking.
Yeah, no, that I strongly agree. So
I'll reach out to Monica. And see what their schedule is on this process.
okay, sounds good.
I have a sneaking suspicion that a lot of it's going to have to do with what Dave said earlier. The township's financial position is not nearly what it's been, so I would suspect that they're going to scale back on a lot of things that they would like to do.
No, I think the way that this works is this is going to be a 5-year plan, and
Right.
we have 2 years to come up with this plan. So we're talking nothing. Because we put it in a report does not mean that they have to do it. It's just they want pie in the sky. List every single thing, even if they can't come up with it. This is reaching for, this is what we would like to see, but I'm not sure it's necessarily guaranteed to be done.
Oh, right.
So, yeah.
But I'm sure they
So,
have
yeah,
a
scale
working
back.
plan.
Working plan has to be set in stone, but implementing it is obviously going to be financially
Right.
impossible probably for some of them, but yeah.
Yeah. Okay. Well, I think that sounds good. I think it's on track. And we'll engage with Park and Rec and see what they want to do with next steps. So I have 2 items left. We need just kind of some general talking about what we want our plans for 2021 to be, and then also to maybe have a discussion about when we want to meet next, so we can do a little bit of planning there, and then we can adjourn. So plans for 2021, is there, we put a lot of things, some of the things that we do or typically do, most notably the roll and stroll in September or early October, we did not do because of the pandemic, right? So I think that the pandemic is definitely not over, but the hope of the vaccine is that over time, the pandemic will, hopefully fade away. We all hope that. So keeping that in mind, what things do we think we want to kind of shoot for as far as events? Do we want to tentatively start thinking about a roll and stroll in September or October? Because if it is, it's something that we should put on our radar now.
So I think
I'll throw a tidbit in for you if it matters, for the Run the Gates initiative that we do in Middletown Township. That's typically the first Sunday in June, and they have got everything on hold over there in Middletown Township until the 1st of October.
So I was
don't know
going to
what.
say my thought process right now I would say let's think about what we want to do for 2021. Maybe at the next meeting, everybody come with some ideas. But for the roll and stroll, I would suggest pushing it potentially to the spring of 2022. And a couple reasons, obviously would be COVID. The second, I know that, this is the 20-year anniversary of the 9/11, and they're going to have a huge event there. So I know Parks and Rec will be all hands on deck for September 11th ceremonies and, preparing the gardens. So not that, we just wouldn't be able to get a lot of help, I think, from them, and not that we don't really ask too much from them, but I know that they will be a little busy with that. So my thought was just, why not wait until maybe the spring to do it when people are more back to normal.
Yeah,
I mean,
that's fine with me. I didn't feel strongly about necessarily having it this year. I thought we should have the discussion about whether we want to have it.
Yeah.
And so I
Yep.
think that, I think that you're right, that if we had something, we'd probably have to wait until early October. And I think that we'd probably be able to have the event, but I think the problem is that, you're going to have to get vendors and other things like that months before. And I don't think you're going to be able, with the pandemic still going on, I think there's still going to be enough uncertainty. People are not going to want to commit and things like that. And then with the 9/11 event, I agree with you that obviously we probably wouldn't want to have anything in even mid-September. So, you're talking about late September, early October.
Mhm.
So it may just be easier to wait until spring 2022. I think that you could
Yeah.
I think you could do it in October, but it's quite ambitious and a lot of things would have to fall right and you may need to cancel it if they don't fall right. So 2022 is the safe bet.
Certainly gives us lots of time to plan.
So I agree
It
with
will fly right by.
I agree with Lisa about about other planning. Unless someone has something that they really want to share with the group, then something they want to do in 2021. That it's something that we could have a discussion on at our next meeting.
Yeah.
It is quite it's just been difficult to do things, or a lot of the things that we want to do or tend to do when people in an age of social distancing. So, is there anything else that someone wants to add to that?
No.
Okay. Well, then I think that unless someone wants to bring something else up, I think the final agenda item that we have is talking about when we're going to be meeting next. So,
either February or March, but
yeah,
and then we can decide on a date at a later time.
I'm looking at our we met in June and July because we hadn't seen each other for months because the pandemic was just starting. But after July, we went to a kind of an every other month schedule. So we met in September, we met in November, and now we're meeting in January. So the question is, do we want to meet in February or would you like to wait till early March?
I would suggest March, and if anything comes up in the meantime, we're a small enough group, we can certainly communicate.
I think that's
Okay, I'll look at the schedule for March for Zoom meetings and then try to plan maybe a Wednesday. Get back to maybe Wednesday.
right. Sometimes, Lisa, it depends on what's available on the Zoom schedule. It's not.
Right. Okay.
So you have to go back and forth with them on that.
Yeah. Okay. All right. We'll just say March to be determined exact date.
Okay. Sounds good. So it was very good to see all of you. And Lynn, we're glad to have you as an addition to the team.
Thank you.
And
I'm glad I'm here.
yes, we're very glad. We've been talking about having a new member for a long time. So you were we were all smiles when we heard that you joined. So
Thank you.
okay. So is there a motion to adjourn?
So moved.
Okay. Is there a second?
Second.
Okay. All in favor? Say aye.
Bye.
Right?
All right.
Okay.
Bye, everyone.
Bye, everyone.
Stay
Take care.
Bye, everyone. It was nice meeting everybody.